Welcome back to Thorani, I'm Joe B. Are you curious to know how to dry needle the Fibularis Brevis muscle? If so, then this video is for you. Let's dive in. The assessment to determine Fibularis Brevis trigger point that can respond positively from dry needling is through palpation for the presence of allodynia or a painful response to a non-painful pressure stimulus, like a finger pressure. First, palpate the fibular head, then slide your fingers down to the distal surface of the lateral surface of fibula. You can even ask your patient to evert the ankle to make sure that you are at the right muscle track. You can also palpate the lateral malleolus, then go up to the distal 2/3 of the fibula. Any significant tenderness as compared to the opposite side muscle should confirm it. A referral for dry needling should be sent to the referring doctor's office to be signed and faxed back to your office. In addition, patients should also sign a consent to allow the therapist to perform the dry needling service. Before treating, wash your hands, glove up, and sanitize the area with an alcohol prep. The patient should be in a side-lying position with the right lower extremity to be treated uppermost. The therapist will be on that side. Use the fibular head as landmark and palpate that first, then move the palpating fingers inferiorly up to the distal lateral 2/3 of the fibular shaft to arrive at the muscle. Create a space between your index and middle finger of the non-dominant left hand to fit the 0.3 x 30 mm filiform needle. From there, use your dominant hand to tap the needle in, then remove the plastic sheath and insert the needle further on or before the bony backdrop of the fibular shaft. The fibularis or Fibularis brevis muscle originates from the distal 2/3 of the lateral surface of fibula. It inserts at the tuberosity of the 5th metatarsal bone. It is innervated by the L5-S1 superficial fibular nerve, while its received blood supply is from the fibular and anterior tibial artery. It is responsible for talocrural joint plantar flexion and subtalar joint eversion. The cause of Fibularis brevis tendinopathy is from repetitive running and walking long distance that can result to a strain of the muscle. Forceful ankle dorsiflexion and inversion can also result to a strain or a tendinitis. This can lead to a lateral leg or ankle dull aching, sometimes cramping pain with tightness. So do you want to know how to dry needle the fibularis or Fibularis longus muscle? If so, then this video is for you. Thank you very much.